a mobilization for the cuboid. The cuboid is a bone in your midfoot that's on the pinky toe side of your foot. This is a mobilization for if you have somebody else to help you out with this. So what we're going to do is that you're going to get your hands around the cuboid. So there's a couple different ways to find that bone. You can find the metatarsal, which is the extension of the toe itself. So the cuboid attaches onto the pinky toe metatarsal and then the one next to the pinky toe. So that's the fifth one and the fourth one if you're into the anatomy world. So you can trace those down essentially to the middle part of the midfoot where there's not a sort of valley or a squishy place in between those two bones anymore to grab onto that. And then essentially I'm going to grab sort of like a pincer grip like this with one hand, and then my thumb on the other hand is just going to go in that area as well. So I've got the cuboid gripped between my index finger and my thumb here. If you're having trouble finding exactly where that is, essentially if you go to the pinky toe side of the foot, right in the middle of the foot between the heel and between the metatarsals, and you just put your hand there, you're going to grab a handful of cuboid. If you can't find it, or if you're worried about finding it, it's the bone that is most towards the pinky toe side of the foot in the middle of the foot. Okay, from there, there's a couple different motions. So you're going to essentially bend and straighten out the person's knee. So what you're going to do is you're going to let the knee sort of straighten out like this, and as you do, you're going to pull their foot down a little bit into sort of like a ballerina foot. And then after that, you're going to bring the knee up in this direction, and you're going to bring it into the opposite of a ballerina foot. So the top of the foot's going to come up towards the shin. As you do that, or as you do this direction, you're going to press that cuboid bone, or you're going to really sort of keep it pinned between your fingers and try not to let it move as the rest of the foot moves. So here you're relaxing your grip, you're bringing down into ballerina foot, straight knee, and you're coming back here, pressing down. The other thing that I'm doing as I'm pressing the foot into this direction is I'm slightly rotating the foot out towards the pinky toe side as well. That's just going to help you get a little bit of a better mobilization. So sort of in real time, it looks like this. It also helps if you ask your person to relax all the way. It's easy. If the person want to help, you're going to do your best to just let the foot be mobilized. So in real time, looks kind of like this. And you're not pressing as hard as you can. This is gentle. It's maybe 5 or 6 out of 10 in terms of pressure. Again, we're just trying to introduce some motion to the body. You're not trying to force anything or really crank on the person's foot. And that is it.